Hi, Social Policy. We're Group 7 and we did caregiving during a pandemic. The coronavirus outbreak has cost more than 150,000 Americans their lives. Due to the unexpected nature of the disease, there are limited policies pertaining to the issue. One of the biggest challenges that has presented itself within the social work field is the procedure for caregiving. The CDC released a series of statements to offer guidelines for caregivers during the pandemic. They stress the greater risk factors for adults over age 65 and for individuals with underlying medical conditions. This population also has the greatest need for caregivers. According to the CDC, caregivers are required to wear a mask when working. However, they should not place masks on anyone who has difficulty breathing, is unconscious, or is unable to remove the mask without assistance. Also, it is imperative that caregivers have a backup that can assume their position if they become ill. In cases where an individual has dementia, caregivers are also responsible for being present with them in the hospital setting. Caregivers are also accountable for seeking medical attention if the person under their care shows symptoms of COVID-19. Due to the many rules and regulations for caregivers, policies should be established that enforce these rules with a goal to protect high-risk populations. And here, I'll let Serenity take over.
Thank you. When searching up pandemics that are similar to the current coronavirus pandemic, you find the H1N1 influenza of 1918, which killed 50 million people worldwide, and the Asian flu of 1957, which killed around 1.1 million people. The coronavirus pandemic has infected over 116,000 people in the United States and over 23 million people worldwide. There have been multiple pandemics before the coronavirus, and there will be multiple pandemics after this one. With previous pandemics, some even bigger than the coronavirus, there should be policies in place to make sure that people who need caregivers are able to get the things they need to be properly taken care of. There also need to be policies in place to make sure the people who are doing the caregiving are able to be safe. Every country relies on caregivers. Not having policies in place for caregivers during pandemics hurts a huge chunk of the population. We have history books and previous pandemics to look back on to know what we need to do to properly take care of people in need of caregiving. For H1N1, the Center for Disease Control has a plan that includes having a plan for what you will do if someone gets H1N1 or someone you care for is infected. We need to look at previous pandemic policies and put those into action when we confront the coronavirus pandemic. The media's analysis of caregiving during a pandemic is that we need to make sure people have the proper resources to be taken care of and still be able to be safe. In an article from National Public Radio, there is a story about how people who are being taken care of don't have enough masks or gloves to feel safe. The people who take care of them might also take care of other people. If the caregivers don't have enough new masks or new gloves, they could either transmit the virus to other people, or they might not choose to take care of people because they don't feel safe enough. The media agrees that caregivers need more supplies so that they can properly take care of all their patients and feel safe while doing so.
Thank you, Serenity. The government of this election cycle is closely being monitored regarding caretaking during this pandemic. Different states have various ways of addressing the issues, as each state has its own severity of cases. Officials, such as Michigan's Governor Whitmer, have implemented safeguards against transmitting COVID-19 to older clients specifically. According to a document on michigan.gov titled Actions for Caregivers of Older Adults During COVID-19, the direct caregiver should visit the home only if no one can reach the client, or if the client or caregiver network has confirmed a need which they cannot meet in order to sustain the client's life. On a larger scale, the United States Department of Health and Human Services released a statement saying, on April 21, 2020, the Administration for Community Living announced the release of nearly $1 billion in grants to the aging and disability networks to help meet the needs of older adults and people with disabilities as communities implement measures to mitigate the spread of COVID-19. Whether large or small scale, the government is attempting to contain the virus and to aid the caregiving population. Next, Jenna Kowalski.
Thank you, Robert. When looking at the NASW website, there's no news or opinions that specifically related to caregiving during this global pandemic. But this being said, there's plenty of information to provide a good understanding of how social workers feel about how caregivers are given the difficult choice of leaving the client who needs assistance in order to quarantine, or in some cases staying and leaving their families for the time being. On the NASW website, it provides information and news that pertains to the NASW helping out those clients who need additional support. The NASW website shows many examples, such as how they created long-term services and support policy statements, and it shows the increasingly high demand of direct care workers who provide much-needed services for small wages and limited access to health care. This is just one of many examples that show how social workers care for all people, and this helps show that social workers would say that everything in its power needs to be done to help all clients and those who are dependent on others to live. The purpose of social work is to help others in every way, and in this case, those who are dependent on their care workers, they need our help. As a college student, my general public would be my peers. I interviewed 5 of my peers about their opinion on this matter. Overall, most agreed that either way, leaving your family or leaving your client who is relying on you is a very tough choice. Considering a good portion of the clients who need daily assistance end up with their lives in the hands of young adults, this is a sticky situation, considering also that at this age, the caretaker probably has a family of their own to consider. In some cases, the client has offered to give the caretaker a place to stay during these hard times in order to keep the assistance during the global pandemic at hand. Some interviewed would say that when you become a caretaker, you take on the responsibility that should be upheld no matter the circumstance. I believe you with this. These caretakers were hired to assist those who cannot complete everyday tasks that others achieve without any hassle. When they need us the most, we need to be there, by their side when nobody else can be, advocating for those who need it the most.